Well, it's been 5 years since the governor announced Michigan's first COVID cases. The impact of the pandemic is still being felt by frontline workers.
News 8's Kyle Mitchell in studio tonight with their thoughts, a half-decade since the pandemic began.
Brian and Sue, healthcare workers from Corewell Health say they'll never forget the pandemic, from the lives lost to the emotional toll it has taken on so many in their profession.
5 years after the start of the COVID pandemic,
it is hard to believe it's been 5 years. We still talk about COVID like it was yesterday.
Respiratory therapist Renee Gamir says the memories of the patients she treated are forever etched in her memory.
During COVID, there weren't a lot of visitors allowed, and so we were the support system for a lot of those family members that were allowed to be there. So, it's been 5 years, and I still remember faces and names and room numbers that people were in, and so just, those are things that I probably will never forget.
The amount of patients and their condition was something Renee never thought of when she studied to become a respiratory therapist.
I never thought I would see a pandemic like we saw. At Blodgett specifically, we had 2 makeshift ICUs beyond our regular ICU. So we had 3 ICUs going at once.
She says working through the pandemic helped the team learn to work together to care for the increase in patients.
This is an impossible task to take care of all these people, all these critically ill people, but we did the best we could with what we had at the time.
Until antivirals were created, there weren't many treatment options other than providing supportive care.
It was really hard because there was no specific criteria for the type of patient that was going to die from COVID. I mean, I've seen 20-year-olds all the way up to 96-year-olds pass away from COVID. Athletes, police officers, ex-Marines, it doesn't matter who you were. COVID affected everybody.
In addition to the toll the virus took on patients, healthcare workers continue to feel the impact.
Nurses really experienced a sense of moral injury because the conditions of the practice environment didn't allow them to be the nurse they wanted to be.
Jennifer Kaiser is a nurse who completed a study on the years after the height of the pandemic.
So my study was on nurses' professional identity, which is not just doing nursing, but what it means to identify as a nurse, to be a nurse, to have that as part of your self-concept.
The pandemic also had an impact on staffing turnover for hospitals across the country.
We lost over 100,000 nurses throughout the pandemic, leaving the profession entirely. And that number does not include nurses that went to a different care setting. So maybe they didn't want to work in ICU or inpatient anymore.
Respiratory therapists like Renee, who stayed with the profession, know the impact healthcare workers made to save lives and the trauma they saw firsthand, seeing the patients who didn't survive.
It's going to be something that affects healthcare workers for the rest of our lives.
Hospital systems are working to recruit to fill open positions, but the process will take time with the training needed for the roles. Sue?